Hi, my name's Jess, and I'm going to be doing a pediatric assessment on a preschool age child, 2 to 5. So begin by doing hand hygiene. I will be washing my hands thoroughly and cleaning and drying them. Then I'll be walking into the room and introducing myself to the child and the parents, making sure that I do a brief health history check on the child, so asking about any present illnesses or health concerns, any medications or allergies, or any previous illnesses or injuries that I should be aware of. So another important thing is also getting the child to be comfortable with the procedure. So you can show them the equipment you'll be using and you can explain to them what you'll be doing. An easy way to do that is also by using a doll to demonstrate on. So if they're calm and they're cooperative, you can proceed with the examination. So doing a quick vital signs check, I'll be taking blood pressure for a child that's 3 years and older. I'll be checking the radial pulse for a child that's 2 years and older. And for temperature, it is recommended for a child that's 2 to 5 to check the axilla site. So that's just between the armpits. So if the vital signs are stable and there's no concerns, I can continue on. So starting with the general appearance of the child, that includes the hygiene, the posture, the body movement, and the behavior and activity level of the child. And throughout the assessment, I will be looking at the skin, making sure that the color, the texture, the moisture, and the temperature is good. Alright, let's start with the head. So facial features, making sure that they are symmetrical, and also checking to see if the facial expressions are appropriate. A good way of checking that is by getting the child to smile or frown, make a facial expression to see if the facial expressions are moving symmetrically. So checking the shape of the head, the structure of the head, palpating it for any dents or bruises or any bumps or lesions or injuries. Then moving down to the eyes, checking the eyelids, and then moving down to the sclera, making sure that the sclera is white and good white color, the cornea is intact and clear, making sure that the iris and the pupils are round. Then I'll take a pen light and shine a light into both eyes just to check the response of the pupils, making sure that they are constricting appropriately and evenly on both sides. Then moving down to the nose, I will tilt the head back a little bit, shine a light up the nose, check the mucous membranes to see if they're a nice pink, and check for any discharge or blockage. Then down to the mouth, using a tongue depressor, get them to open their mouth and say ah. So depress their tongue, and during this time you can check for the tonsil, the uvula, and the oral pharynx. And then check the roof of the mouth, so the palate, making sure that it's a nice domed arch shape. Before removing the tongue depressor, make sure that they can move their tongue up and down against the tongue depressor to check for muscle strength. So before they close their mouth, make sure that you assess their teeth and their gums as well, making sure that you count the amount of teeth that are in each dental arch, making sure that there's occlusion occurring with the teeth and that the gums are a nice pink healthy color, and check the general hygiene of the mouth as well and the membranes of the mouth, making sure that it's a nice pink and moist and smooth. Alright, so close up. Using my otoscope, I will be checking the ears now. So checking the outer structure of the ear, the pinna, making sure that there's no lesions and there's no extra skin tags or injuries. Then moving the pinna up and back, taking the otoscope, looking into the internal structure of the ear, checking if there's any discharge, if there's any irritation, redness, or blockage. Do that on both ears. Now for the neck, making sure that they can go up, down, side to side, and checking the lymph nodes. So the lymph nodes that you'll be assessing in this area are the submental, the submandibular, the tonsillar, and the cervical, just to check if there's any enlargement or swelling, or if there's extra heat that's radiating out of it. Chest now. So with the chest, you will be checking their breathing, the quality of their breathing, the rate, the rhythm, and the depth of their breathing, and making sure that the chest is rising appropriately on both sides. So a good way of doing that is by putting your fingers like this and putting your thumbs down at the midline along the lower costal margin, front or back, and making sure that you can see your hands rising evenly. Get them to take a couple of deep breaths as well. This is where I start my auscultation of the lungs, the heart, and the abdomen. So with the lung sounds, I'll be doing it bilaterally, front and back. So upper, middle, and lower. Checking for any wheezing, crackles, or absence of breath sounds. Then moving to the heart, checking the rate, the rhythm, the quality, and making sure that the intensity is appropriate as well. Another good thing to assess is for any heart murmurs. So you'll be doing that when they're sitting up and then doing it when they're supine. So you'll be checking it in the aortic, the pulmonic, the Erb's point, apical, and tricuspid. Sitting up and then supine. So if there are any heart murmurs, hopefully it's innocent, but you should note it and they should get further testing to see if the heart murmur is due to functional or organic. Keep them lying down, separate the abdomen into 4 quadrants, and check for bowel sounds in the movement of the bowels. Making sure that there's bowel sounds times 4. Then you start your palpation. So I'll be doing superficially at first, checking for muscle tone and any tenderness. Then I'll be doing a deep palpation, so that's to check for any enlargement of the organs or for any masses. So starting from lower to upper, just press down more firmly. Alright, then I'll be checking the femoral pulses and the inguinal lymph nodes to make sure there's no enlargement or swelling as well. So down to the genitalia area, I'll be exposing them. Hopefully they're comfortable. So you'll be noting any external appearance of the structure in the organs and, to see if it's developing properly or if there's any enlargement in the organs, and then the skin surrounding it, making sure that there's no redness or rashes or lesions, and making sure that there's no discharge as well. There shouldn't be any discharge going on. Cover them up. This is a good time to ask about elimination. If they're urinating properly or if they're having normal bowel movements. Alright, so last 2 is the back and the extremities. So getting them to stand up, you can check the curvature of the spine, make sure that it's a nice S-curve, S-shaped, and then getting them to bend down so that you can feel and look at the spine to see if it's straight. So getting them to stand up again, you can check if their shoulders are level and if their hips are level. Alright, so time for the extremities. I like to do CWMS on them, so color, warmth, movement, and sensation. So moving from the shoulders downwards, check the brachial pulse, the radial pulse, then do a cap refill to see if there's appropriate amount of circulation going into the hands. Then get them to squeeze your hands and make sure that they can feel you squeezing all their fingers. Perfect, so down to the legs now. Same thing. Upper to lower, popliteal pulses are there, pedal pulses are present times 4, doing cap refill to check for circulation, and for movement you can do the plantar dorsiflex. So putting your fingers above their toes and getting them to point their toes against towards their nose, and then putting your hands at the bottom of the feet and getting them to push towards you, pointing the toes towards you. Alright, so that is the assessment, and ask them if they have any questions or concerns, and make sure that you give positive feedback to the child as well. Hopefully they had a good experience. Thank them for being so cooperative, and that's it.